Hello students, welcome to another episode of Learning with Lafferty. So within this chapter, I'm going to be talking about body fluids, aka your water, your electrolytes, and the acid alkaline system of pH. So like always, Manee is going to join us out of the water. So manatees spend majority of their time within the water. But for us, obviously, we need the air. We don't need to be in the water that much, okay? Even though it's fun to actually play in the water. But we can't live underwater like you do. But even you need to come up for oxygen. So as an adult, a man, about 70% of that body could be made up of water, okay? And a woman, it's about, 60 to 50% of the body weight comes from water. And actually, in an infant, it could be upwards of 75%. But think about, when we think about adipose tissue, contains less water than muscle tissue, okay? So we think also, too, if you're overweight, you actually have less water than people that are thinner, okay? So you can't really think about using the excuse of, I'm just full of water. Now, fluid itself needs to be thinking about where that this fluid lives. And there's two major fluid compartments within our body. Now, again, body fluid contains the water, but it also is going to contain electrolytes, salts. And we think of all those elements and ions, nutrients, gases, waste, okay, and very special things such as, of course, enzymes and hormones. Now, within this video, I'm going to focus on talking about what happens later on in the video if we have too much hydrogen. Okay, so we'll talk about that element here in a few minutes. Now, two different components, okay, two different fluid compartments. The first fluid compartment is called the intracellular compartment, and the extracellular compartment. Now, within the intracellular compartment includes water located in all of the body cells, okay? Most water, about 63% of our water to be precise, is inside the cell, okay? So inside the cell. Extra, the X belongs on the outside, okay, so that hopefully will help you. So the extracellular compartment includes fluid located outside of all of our cells and represents the lower amount of our total body when we think of water. Now, the extracellular component of it is that compartment has more compartments within it, okay? So we think about with that, we think, of course, the water between the cells called the interstitial fluid, water within the blood vessels, such as our plasma, and then water within our lymphatic system, which was our lymph. Now, there also is water within the blood vessels, and the lymphatic system can also be called the intravascular fluid. Okay, so blood vessels and lymphatic can have a little separate name. Okay, it's the same fluid. They just kind of changed the name a little bit for and kind of combine them two together. Now, transcellular fluid, still a part of the extracellular component, is this fluid that makes up all the rest of the liquids that I talked about. Okay, so we think about cerebral spinal fluid would fall under that, the humors of our eyes, synovial joints. Okay, we'll talk about that under the skeletal chapter. These cirrhosis fluids in our body cavities. Remember, there's liquids between all these parietal and visceral membranes throughout our body, and all of those glandular secretions, okay, that we've talked about many chapters ago when I talked about the integumentary system and talked about the endocrine system. But also we think of, when we think of those fluids, of the extracellular component, it is the fluid that's between the cells that makes up most of this compartment. Now, definitely when you think about the intercellular compartment and the extracellular compartment of the in and the out, think of that barrier, that gradient. Okay, remember, from a high concentration to a low concentration would be diffusions and filtrations. Osmosis, of course, directly relates to water. And then you think about the active passive transporting, from a low number to a high number, forcing more out or forcing more in. Okay, so definitely think back to the cellular chapter itself. Now, when you think about water, we definitely need to have a balance when it comes and the importance of water. So remember, water is a solvent, the universal one. It transports as a medium. It participates in all chemical reactions. So we definitely need to have water, and water is one of those that has that VIP pass. Okay, it can come and go from the cell as it is needed. But the force of the water in the vessels helps to maintain, such as our blood pressure, our blood flow, and how things pass into and out of the capillary beds. Now, the changes in the water volume then is, of course, going to change our blood pressure. Now, one thing to point out, and I mentioned this earlier with the percentages, is the amount of fat increases, the percentage of water in the body decreases, because adipose tissue, again, does not hold very much water compared to muscle tissue. And that's why we see that, of course, more danger when we think about as you get larger in size, of sometimes a problem with you not consuming enough water. Now, when we think about, taking water in versus what goes out is important with that water balance, okay? So the amount of water coming in is the intake, okay, should equal the amount of water eliminated through our output. When the water balance is unequal, that's when we're going to see problems of course, we think of dehydration. We also think of edema, okay, those particular things. So what comes into the body, okay, what we're giving the body equally needs to be leaving the body on a regular basis. So we should take in about 2,500 mLs each day of water intake. Now, 60% of that is going to come from us drinking liquids, okay? 30% of it, the water that's in our foods, and then the rest, the 10%, actually comes down to that metabolizing process of breaking down the foods. Now, as far as outputting, if that's inputting, most of the outputting, 1,500 of it on an average, should be coming from our urine. The next contributor would be our skin. And then lastly, the two would be our lungs, every time we actually breathe out, and our feces play a role into the output. So input, of course, is the food that we're taking in, which makes sense. Most of it is in a liquid form. And then water loss throughout the day, most of it should be at a urine basis. Okay, with coming behind that would be the skin, the lungs, and your digestive system. Now, the control of when we're thirsty is happening at a part of the brain that I've talked about before, of your hypothalamus. Okay, it actually has a thirst center within your hypothalamus. This center is going to play a huge role in the regulation of the volume of our blood and the composition of the blood via the water that we are consuming. So as we increase that extracellular fluid or decrease that blood pressure, that's going to stimulate the thirst center, causing you to drink water or other fluids that will then dilute the blood, increase the volume. So as the body loses water, the thirst center in the hypothalamus is stimulated, and of course makes you want to drink water. And drinking restores the water balance, the consistency, so not only your thirst goes away, but your hypothalamus is satisfied at that point too. But unfortunately, as we age, that thirst mechanism decreases. That's why we're usually more prone to dehydration. Now, fluid homeostasis also relies upon that coordinated effort of the hypothalamus of the thirst center, which controls, of course, our intake, but also plays a role in controlling the kidney, which will also modify the volume and concentration of our output. So fluid homeostasis comes from three things. First of all, it comes from our blood pressure. That's going to help to regulate it, okay? So again, the body itself does not sense or regulate the overall fluid volume. Instead, it senses and regulates our blood pressure, which is overall controlled by the fluid volume. Thus, that center in your hypothalamus and your kidneys are the effectors that will directly change the blood pressure. Now, number two goes back to our plasma, the omosity of our blood. Now, so there's omosity regulators in the hypothalamus and actually everywhere throughout our body that sense how concentrated our blood is as far as the water plasma aspect of it, and will change in response to sodium concentrations. And I've said that before. So sodium likes to be followed by water. Okay, so if there's a lot of sodium, there's a lot of water. If there's lesser sodium, there's lesser water. And then lastly, through that, the plasma concentration of potassium also is going to play a role in where our fluid is at. And it's like, why does sodium and potassium play a huge role in that? So let's talk about here and just kind of remind you the different type of electrolytes that our body has. Now remember, electrolytes are cations and anions, and these ions as a group are going to be components that are separated either positively or negatively charged in the solution. Now, positive cations, okay, are going to be sodium, potassium, calcium, magnesium are examples of that, and that's where you see the plus symbol, okay. Anions, okay, negatively charged would be such as bicarbonate, chloride, phosphates, and even proteins are going to fall under the negative side. Now, it is important, since we've talked about, of course, water can come and go, but it is important to understand that once this sodium and potassium and all these ions get in our body, where do they like to hang out in higher numbers? Okay, because remember, the gradients are important, high and low. Now, in high numbers, sodium, the positive one, is the most abundant cation in the extracellular fluid, okay, outside of the cell. Okay, so this is the one that plays a huge role in balancing our body fluid volume. Now, potassium is the one that likes to hang out in a high number on the inside of our cell. Okay, and it, of course, helps with, we talked about excitability with neurons and how that action potential is going to occur. So sodium's on the outside in high numbers, potassium is in the low numbers, and again, they're still both going to be positive. Now, other ones, far as negative on the ani side, are going to be chloride. Chloride is the main anion that likes to hang out in high numbers with sodium. So hence, sodium chloride. Okay, so again, on the outside, positive and negative. And then another one that's important when we think about a negative, as far as high in numbers in one area, and the most abundant are all these proteins. They are anions that are found on the inside. Okay, so you think about potassium and protein. So the two P's are highest numbers. They like to hang out within the cell. So sodium and chloride on the outside, potassium and proteins on the inside are the highest numbers. Chief, main areas they like to hang out. Now, besides our electrolytes and water, the other thing that we have that helps to regulate our fluid balances inside and outside of the cell are going to be hormones. Now, a number of hormones will work to control a feedback loop to regulate these body fluids of whether they need to be on the outside or they need to be in the inside. So let's look at these hormones. The first one is going to be aldosterone. Now, aldosterone is an adrenal steroid hormone that will alter our sodium and potassium by the kidneys. Okay, so its release is stimulated indirectly when we have low blood pressure, and then the hormone AT2 mediates its effects. That will promote reabsorption of sodium and thus water into the tubules of the kidney system. Then that will increase our blood pressure. So again, remember feedback loops. Okay, actually chapter 1 in all textbooks talks about the introduction of this homeostasis type of system, these feedback loops. So if you have low blood pressure or even high potassium concentrations, aldosterone is going to be secreted, okay, and it's kind of a stair-step type of approach to even get aldosterone, okay, happens within the kidneys. So once aldosterone is secreted, that is going to increase the sodium reabsorption, okay, so remember what follows, sodium is going to follow water, and that, of course, is going to increase the blood pressure. The other way it also do it is by increasing the potassium secretion, which is going to increase the urinary system to lose potassium, and that's, of course, going to lower down the potassium level. So again, sodium, potassium likes to be in the inside of the cell. On the outside is sodium, but remember, water likes to hang out in higher number with sodium. And kind of with that, when you think about, okay, too much sodium versus too much potassium, both of those do play a role in, of course, the neurons firing and the action potential to allow a nerve impulse to even happen. Also, sodium and water at excess retention can cause, of course, the blood pressure then to drop. The excess potassium then can disrupt your heart. And that's why we have to be very careful of having hypokalemia, is where we have too little potassium, and those low levels in the body fluids is going to cause, of course, cardiac arrhythmias, going to cause hypoventilation, muscle fatigue, and then of course that can come from us losing too much water. Okay, chronic diarrhea, coming out, or prolonged vomiting. Hyperkalemia is excess of the potassium, which usually points to kidney disease itself. Now, the second type of hormone is going to be the antidiuretic. Okay, so it is again synthesized at the hypothalamus. It's secreted by the posterior pituitary gland. ADH secretion is stimulated by our thickness of our blood and how much water is being entered and exiting through our blood capillaries. That, of course, is stimulated at the hypothalamus, and then low blood pressure can also stimulate this ADH production. This goes back to affecting the kidney's collecting duct in response to ADH, which I would have talked about under the urinary system. Now, reabsorbing that water, again, keeping that water, of course, then is going to increase and dilute that sodium levels, and then, of course, that's going to increase the blood pressure. Now, within our kidneys and within our heart, we also have a couple other hormones that are going to be secreted in response to, again, the thickness of the water concentration within our blood supply. And we think about our heart, of course, that one particular is going to affect whether our heart is going faster or going slower. So the three main players when we think about regulations within our body is the potassium and the sodium, of course, water in response to both of those. So sodium and potassium and water are going to directly affect whether our blood pressure is high or is low. And that, of course, is going to have a direct effect on the various organs throughout our body. Now, the next part I want to talk about within this video is going to relate to the acid-base balance, okay, the pH scale. So remember, a pH scale is a measurement of how acidic or base, alkaline a solution is. Now, remember, the pH scale is going to measure hydrogen concentration in the solution, with higher numbers indicating a lower concentration. Now, body fluids itself are slightly alkaline, and when we think about our blood, should be anywhere from 7.35 to 7.45. Now, these fluids must be kept within a narrow pH range, or will have damage to our cells, and of course could even go as far as death if the pH scale goes too far. Now, one thing I want to point out to remember when we think about the pH scale: an acid dissolves or splits into hydrogen. A base removes the hydrogen. As the hydrogen increases, the pH decreases. And as the number of hydrogen decreases, the pH is going to increase. So we're at 0 on a scale from 0 to 14. 0 would be the highest hydrogen, lowest number. And then at 14 would be the lowest hydrogen, the highest number. So our body must either neutralize or excrete that excess acids, and the acids are coming from the foods and the metabolism that's happening within our body. Now, there are three ways that our body regulates pH. First is through a buffer system. This is the first line of defense. Now, this is about removing or adding hydrogen, and these buffer systems are based on a lot of bicarbonate that will maintain extra hydrogen as needed. So a buffer is just a chemical substance that prevents large changes in our pH. So the buffer pair is a base and an acid. So if our hydrogen in our blood increases, the base removes it from our blood. And if the hydrogen decreases, the acid part of it is going to donate hydrogen to the blood. So by removing and adding that hydrogen, it's going to maintain a normal blood pH. Now, one ion that's really good is bicarbonate. Okay, so bicarbonate ion is a base and an acid. So our body is going to, if we don't have enough hydrogen, donate some of that hydrogen. And if we have too much hydrogen, it's going to cause it to be released out of our body. Now, the second line of defense is going to be our lungs. Now, the respiratory system can compensate increased metabolic acid production through faster, deeper breathing, which eliminates more carbon dioxide and makes the blood more alkaline base. Now, the lungs itself then can handle how much CO2 is happening and staying within our body or leaving our body. So changes in respiratory activity will cause a change in the pH. Now, in the lung side, how it regulates it is if we do lower respiration, slower respiration can increase our hydrogen levels. So again, that hydrogen is going to go higher, the number, of course, is going to go down. If we breathe faster, it can decrease the hydrogen. So if we have decreased hyperventilation, then we have the condition of respiratory acidosis. On the other side of that, if we have hyperventilation, we can be expelling too much CO, and that would be decreasing our CO. That decreased hydrogen then increases our blood pH, and then we go into respiratory alkalinos. Now, the third line of defense we have is going to be your kidneys. So buffers are first, different enzymes, again, especially a lot of bicarbonate to, again, give and get hydrogen as needed. Respiratory is next, how fast we breathe in and breathe out. And then lastly, the kidneys regulated by either reabsorbing, keeping it in the body, or secreting hydrogen as needed in our urine. Now, kidneys actually are the major hydrogen eliminators. Now, they can reabsorb hydrogen as needed. They can also reabsorb bicarbonate, which is that buffer, as needed. Of course, they do the opposite. They will cause it to be secreted into the tubules, okay, and that, of course, is going to eliminate hydrogen or bicarbonate from our body. One thing neat about the kidneys, too, is they can also make bicarbonate. And remember, bicarbonate is one of those that we get from our pancreas, but we can also have it made within our kidneys. And remember, bicarbonate is like the Tums of our body, okay? It's a neutralizer of acid, okay? So we need it on the hydrogen side. So the two terms you'll see is alkalinos. It could be respiratory or metabolic, or acidosis. That could also be respiratory and metabolic. Below 7.35 or above 7.45, because remember, our normal range is 7.35 to 7.45. Now, some disorders we can think about within our body fluids would be edema, which is an accumulation of excess fluid. And again, fluid that filters out of the capillaries into the interstitial spaces, that's called interstitial fluid. Anything that increases the fluid pressure or decreases that osmosity pressure within the capillaries could compromise how much is leaving the capillary beds. That will then increase filtration. So again, too much swelling in a part of our body is edema. Now, the other side of that, of course, would be dehydration. Okay, that's when you have very severe deficiency of body fluids. Now, of course, there could be many causes for it. It could be, of course, you have diarrhea or you're vomiting. It also could come from you're just not getting in enough liquids to begin with. So hopefully within this short chapter, I've done a lot of reminding from things that I would have talked about, and I really highly encourage you to watch the chemistry video to kind of understand, again, more about those ions and pH. So this was a video that kind of re-added to hopefully the knowledge that you have about chemistry and the exchanging of fluids inside of the cell and outside of the cell. Remember, it's got to get around that cell plasma membrane itself. So me and Manny look forward to seeing you within the next video. Go get you a drink of water. Even though you may not be thirsty, don't wait for your hypothalamus to tell you. I look forward to seeing you within the next video.